Okay, welcome and thank you all for joining us today and for joining Assisi Animal Health on the educational moments we'd like to have with you today. The subject is addressing cat and dog mobility issues during a pandemic, the shelter's role while sheltering in place. Our presenter today is Kara Burns. Kara Burns is a licensed veterinary technician with a master's degree in physiology and a master's degree in counseling psychology. She's the founder and past president of the Academy of Veterinary Nutrition Technicians and has earned her VTS nutrition. She teaches nutrition courses around the world and on the VIN Veterinary Support Personal Network. Kara is the Director of Nursing for NAVC, and she is the editor-in-chief of Today's Veterinary Nurse. She has been featured on the cover of the Veterinary Technician Journal and the NAVTA Journal. She was named North America's Veterinary Conference Technician Speaker of the Year in 2013, and in 2016 she was granted an honorary VTS Internal Medicine in 11, and she was also granted an honorary VTS Dentistry in 2012. You can tell she's a very busy person. Please welcome Kara Burns.
All right, thank you so much, and thank you for having me, and welcome everybody. We're going to be talking about cat and dog mobility issues and how those are probably, or very well could be, worsening during this COVID pandemic, and how we as shelter workers, veterinary team workers can help our owners to get our patients moving. So thank you. First, I would like to thank Assisi Animal Health for putting on these webbies for our shelter employees and veterinary team workers. These are huge. So thank you. Thank you for having me as well, because you know I love to talk about nutrition and different types of mobility issues. So thank you all around. This is a huge service that that Assisi is providing to us. So coronavirus, you guys sick of hearing about that yet? I think it's going to be with us for quite some time. But right now, most of America is at a stay-at-home and shelter-in-place mandate. They're starting to ease restrictions in some states, but still a lot of people are in their homes, working from home. And I can imagine from the shelter standpoint that times have changed for you as well. I have been seeing and following the surge in adoptions now that people are staying home, going to shelters and rescues and adopting more pets. I would love to know from the shelters themselves, is that true across the country? Is it regional? But at any rate, we will talk about some different protocols that we can incorporate in the shelter setting as well. So we're being told to flatten the curve, right? We're under strict stay-at-home orders, as we've mentioned, in an attempt to flatten the curve and not overwhelm our human hospitals. But that being the case, are we just kind of hanging out, sitting on the couch with our dogs? And maybe we are flattening the curve, but we ourselves are getting a little more curvier. And because we're spending more time at home, we're spending more time with our pets. And as I said at the beginning, I'm hearing that shelters are truly increasing their adoptions, which is wonderful. So more time at home with their pets, or maybe more time at home with a new pet. And so we're going to have to discuss, even though it's painful for some of our pet owners, physical exercise. And what my focus is on is exercise within the pet population. I'm well aware that we also need to encourage human owners, but that's not our role, right? We're in the veterinary profession, we're in the animal profession. So luckily, if we talk about physical exercise for our pet owners, then along with that comes, someone has to do that exercise with them. So physical exercise for humans as well. But we know that physical exercise it helps to alleviate stress, is truly an anti-inflammatory, and obviously helps combat obesity. And we're going to look at these three, because what we need to do is encourage our pet owners that are adopting to get moving. And maybe for the animals that still are in the shelters, you guys are probably getting them moving as well. But maybe now we can get them moving even a little bit more. Exercise, physical activity is the most effective non-drug modality for reducing pain and also for improving movement in osteoarthritis patients. Obviously, exercise is going to help us reduce weight because there's more calories expended. And as weight comes off, overall health of the animal improves. And exercise, once we start doing it, we do realize this, but with our pets as well, exercise is a great stress reducer and is a way to release tension. And so we're going to focus on these three: osteoarthritis, pain and inflammation, overweight and obesity, and then stress in our animals during the COVID pandemic. So what is osteoarthritis? I think all of you know as well as I do that it's progressive joint inflammation, which leads to that cartilage in the joint deteriorating. Most of us know someone, or we ourselves have osteoarthritis, so we can relate to our pets when they have osteoarthritis. And if we're looking at the canine population, about 20% of adult dogs have osteoarthritis. Adult cats, it's 33%, and cats over the age of 12, it increases to 90%. So how many cats in the shelters are you working with that are over 10 or 12 years old? The majority of them, 90% of them, are going to be experiencing osteoarthritis. And osteoarthritis is the #1 cause of chronic pain. So we definitely need to take a closer look. So where are we seeing osteoarthritis in pets? Well, similar to humans, in our shoulders, elbow, carpus, which we know to be our wrists, knees, our back, hips. I mean, just talking about some of them, I'm a little bit older than probably most of the people on the webinar, and as I mention each one, it hurts. So I can definitely relate to osteoarthritis in a number of these areas. And the same is true of cats. So on the right-hand side, you see that cats also shoulder, elbows, carpus, knee, hip, and back. So what are some of the risk factors? And again, I think those of you that are working in the shelters and for rescue groups, we are seeing obesity. We'll talk more about that. Trauma. So, are you getting animals in that have been, in some traumatic experience, that maybe have had surgery? Because regardless of the expertise of the surgeon, and it's nothing against surgeons, but we cannot, and surgeons cannot 100% put that joint back to normal. So they may get pretty close, but it will never be truly the same as it was before the trauma. So therefore, we need to consider surgeries and traumas when we're talking about risk factors for osteoarthritis. Age. We see, and you heard earlier with the prevalence, that as pets get older, that's a risk factor for osteoarthritis. Genetics, we know that there's nothing that we can do, but because genes are predetermined, but we can identify different lines, certain breeds, certain lines within breeds, and help breeders to maybe not continue that line, or to help identify it. And then large breed, and not just large breed dogs, but large breed cats. You guys know as well as I do that large breed cats, Maine Coons, Norwegian Forest cats, Bengals, there are some large breed cats in addition to large breed dogs, and large breed alone is a risk factor for osteoarthritis or joint disease. So there's 4 stages when we're talking about osteoarthritis. The first 2 really go unnoticed throughout the veterinary profession for the most part. It's being looked at more closely now, so we're starting to pick up on the earlier stages. Stage 1, early signs. It's typically in our growing puppies or young adult dogs. It's hard to identify unless they have a developmental orthopedic disease. And truly, it's just, intermittent signs that last just a few seconds. Maybe the dog limped, once, or maybe he's just a little tired after the walk. Whereas stage 2, now we're seeing intermittent signs. It's truly the first flare-ups, but it's easy for our owners to rationalize, oh, we were playing this weekend, and, on Sunday night, Monday, they were really just kind of, laid back. Well, it might be that in young adult dogs that are weekend warriors, they may start to be exhibiting intermittent signs of osteoarthritis. Stage 3 is typically when we're seeing, and what most owners think of as osteoarthritis, right? We're starting to see performance impairment. There's progressive loss of activities of daily living. So they're exercise intolerant, and maybe they aren't making it outside to, they're house trained, but they're in pain. So, they're not as quick. And then stage 4, loss of mobility, strength, and fitness, and loss of ability to walk. It's much harder for owners and shelter workers and veterinary teams. It's harder for everybody to manage, but it's especially hard, obviously, on the dog or cat themselves. So this is just an illustration of a normal joint. This is, a knee joint. A normal is on the left, osteoarthritic joint on the right. And so you can see the visual of an inflamed synovium, osteophytes, destroyed cartilage, and cruciate ligament. So the ligaments start to I don't want to say decompose, degrade. They start to degrade because, again, that cartilage is being destroyed. To see it a little bit more, in quotes, normally, on the healthy side of this knee is on the left and arthritic on the right. And you can see the differences. There is some swelling. You can see here that the meniscus, some of the ligaments within the joint itself are degrading. You can't see the drying out as well, so the loss of the synovial fluid, if you will, but you can see osteophytes, destruction of some of the cartilage. And just looking at that, I think you can feel along with me that that's painful. So our owners are reporting, and you may even get surrenders because of this, or maybe you're seeing this when you're working with the dogs and cats. But what we're seeing is difficulty with rising from rest. difficulty walking, climbing stairs, especially our small breed dogs have issues climbing stairs, running, jumping. And the same can be said of cats, but with cats, what we're going to see, and we being the extended veterinary team here, so myself as a veterinary nurse and all of you as shelter workers, we're going to get this more from owners. So mobility, that's one of the signs, but cats, as you know, are not going to show pain. They're not going to show any signs that there's an issue. So what owners will talk to us about is the lack of willingness for the cat to jump. Or maybe they've started, going outside the litter box. I know that's one of the top reasons for surrenders to shelters. So we need to ask some more in-depth questions, because obviously we're going to have to determine the cause of why the cat is going outside the litter box. Is it fluted? Is it, a number of other things? Or could it be that the pet owner's litter box is too high for an older arthritic cat? They can't climb into it, so they go next to it. We find these answers through our history taking and questioning of pet owners. The second one, activity levels. So the activity level is usually reported to be decrease. So, increase. The pet is doing even more sleeping, just hanging around, curled up maybe, or sleeping differently, but they're typically less active. Grooming habits. You guys are probably seeing mats in the back half of the cat. They can't reach that to groom. This cat is also quite tubby, but yeah, that cat cannot reach the back to groom. Or the claws are growing around because they can't stretch because of osteoarthritis to we call it sharpen their claws, but they can't do that any longer. And again, our owners are going to be really telling us about these signs. And then temperament, right? We know cats love bags, but they love to hide. And when they feel threatened or in pain, they're going to hide more. So we hear more from pet owners, oh, I haven't seen him in a while. Well, that's a red flag. Or like the cat on the right. People are like, oh, it's a grumpy old cat. No, it's maybe grumpy because it's painful. But, we have to stop allowing that rationalization of, oh, it's just due to age. It's just an old cat. Old age is not a disease. We have to figure out what is going on with our different pets to truly figure out why they're acting the way that they're acting. But these words are things that you and I can pick up when we're talking to cat owners and start thinking, hey, you know what? That might be due to osteoarthritis. And as you guys hopefully know, Assisi Animal Health has some phenomenal products to help with this arthritis and inflammation. Their pulsed electromagnetic field therapy, which we know to be the Assisi loop, delivers a signal that's tuned specifically to minimize pain and accelerate healing. How awesome is that? And I also think it's pretty great that it stimulates the body's own natural anti-inflammatory process. So using the body's own processes to help speed the healing, that's amazing to me. And so thank you again to Assisi for putting this on, and please check this out. The other, or another issue that we touched on briefly, but now we're going to talk a little bit more in depth, is obesity. Obesity is not just a cosmetic issue, it's a health issue, and it's an epidemic. So our last research found that almost 59% of dogs and 60% of cats are overweight or obese. That is just astounding to me, 60%. And I'm sure that you guys are seeing your cats and dogs in the shelter. Many of them probably are overweight. Many of them may have been surrendered for being overweight. So what are some of the consequences of obesity? Take a look at this dog. Now this, as we know, is a golden retriever, and you can see the pain on his face. You can see that in his eyes and how he's standing. His back legs are splayed. He's extremely lame, which I know you can't see there, but you can tell from the way his legs are. He's trying to hold up this excess weight, and then his front legs are pigeon-toed in, so they are, all four limbs are trying to hold up this very large body. And then respiratory issues. Now the picture probably shows the tongue a little more bluer than it is, but there is blue tinge to this because obesity obviously plays havoc with the respiratory system. So that's the bird's eye view. And then talk about osteoarthritis or joint disease. Oh man, look at that. That we have some serious hip dysplasia, some serious joint disease in this radiograph. So this guy, he is painful. So I know most of you probably know a number of conditions that are associated with obesity, but are we talking to our pet owners about this? Arthritis, that's what we've been talking about, right? Inflammation, joint disease, difficulty breathing, diabetes, high blood pressure, increased anesthetic risk, and decreased immune function. I know this visual truly oversimplifies it, but if you look at the Weight Watchers model of weight management, really it comes down to less calories in, more calories out. That's why Weight Watchers, much more than some of the other human weight programs, has been successful for so long. It's watching the calories you take in and increasing your exercise. The same is true for dogs, cats, birds, horses, hedgehogs, you name it. So now let's talk a little bit about the stay-at-home stress that's probably happening, how we can help that, and then we're going to look at some different ways for shelters and pet owners to get everyone moving at least a little bit more, and every little bit helps. So I would say that we as humans during this pandemic, under stay-at-home orders, it's extremely stressful. Our routines have changed significantly. They've also changed then significantly for our pets. Pets are experiencing stress and anxiety right along with us. And yes, we've all seen the working from home. You know, these guys are not understanding why their humans are home. Cats probably don't want their humans home, right? But you know, even some of these dogs, look at that pug on the upper right-hand side. He's adorable, but I would say that's a look of stress more than, you know, yay, we're home working. So routines have changed significantly, and animals, along with their humans, are stressed. So what are some of the signs? you guys know this just as well as I do. You see this on a daily basis. Stress in pets, changes in toileting again, GI issues, increased grooming, decreased food intake. One of my big concerns, because we cannot have animals not eating. We need to calculate out the amount to feed them, but we have to make sure that they are actually taking in nutrients. Hiding, they're less playful. They might be barking less, barking more, but there's a change. And as you can see in this image, there's definitely some destruction that has the potential to take place. Maybe they've been very well behaved, but now the stress is causing them to maybe chew on shoes or start to chew on some household items. So how are we going to change some of this? I mentioned at the beginning that getting moving and exercise, physical activity, whatever we want to call it, is going to help with all three of these. So we can increase activity while these pets are in the shelter. And you guys probably have better ideas than I do. I mean, the bottom right, I know you probably have cat rooms and cat colonies, but even if they are in, a similar setup to on the bottom right, we can still get them moving. Toys, cats love toys. Cats love, these wands with the little dangly thingies, and they get all excited. He's got a, forgot what that is called. Wow, I must need lunch. But you know what I'm talking about because I'm pointing it out here. But they love those. And, the less expensive, the better. Because I think as you have seen and as I have seen, we can buy the really expensive stuff, but they play with, milk rings from milk jugs, the feather toys. Some owners can take their cats safely on a walk with a harness. And then catnip, very few cats don't love catnip. I have seen some, but and this also increases their predatory nature. So they can hunt, they can play, and so we need to encourage owners to keep their pets active. And it's not as hard as our owners think. A laser pointer, as long as it's not obviously in the eyes, but a laser pointer, cats love that. But I like these interactive toys that you see on the bottom. How about dogs? Let's get our owners up and moving during this, stay on the couch pandemic and walk their dogs. And, we don't have to have them walking, miles and miles. They don't have to run a marathon or do a triathlon. They just need to get up and take the dog to the end of the driveway. Start small. Doing yoga. If you saw me, you would know that I never do yoga. But I do the walking. But I mean, look at how much fun that dog is having. And then just getting out and being with their pets. And I know that you as working in shelters have different ways to get the dogs moving. So let's continue that. So what about physical and emotional exercises? We talked about walking, right? But how about some of these feeding puzzles? We can buy this bone on the upper left-hand side where you put a treat in and the dog has to work for it. That's great. But with the pandemic and the many people having lost their jobs, they're not going to be wanting to spend a lot of money. There are homemade feeding puzzles. This one is just a muffin tin with some tennis balls. You put a treat under some of them and the dog works for it. They have to think. It uses their brain. And then up in the upper right is the same type of thing. We all have plenty of toilet paper now, right? So we take the toilet paper rolls, the core, and we put, those in a sneakers box and just put some treats in some of them. The dog has to work to get them out. So I'm not saying let's go spend thousands of dollars. Let's either go for a walk or let's make some brain stimulating toys at home. Cats love cat condos, which I'm sure you guys know. We can also do emotional exercises and feeding puzzles at home. So an empty egg carton tin or egg carton, just put some kibbles in there, or get a water bottle, punch some holes in it, put some kibbles in there. They have to move it around. They have to work for it. They have to hunt for their food. Again, it's great emotional exercise. And all of these are getting the pets moving, and getting their brains engaged and reducing that stress, helping with inflammation because the pets are moving. And obviously any movement is going to help with managing obesity. So we're at 12:30. So I just wanted to say thank you to all. Please keep 6 feet apart from other humans. Wear your masks when you're out or when you are working around other humans. And please stay well. And truly, I appreciate you being here and listening. And so thank you also for all that you do for our pets in shelters. We couldn't do it without you.